So, good afternoon, everyone. I'm Pooja, and I would like to welcome you all to today's live reading session from Let's Up Language Academy. And let's just wait for a few minutes for more people to join in, and then we'll begin shortly. So, yes, good afternoon, Lejuke Nair. Good afternoon, Ginny Vinu. And yes, hi, Benita Reggie. And hello, Sinu Jomi. And hello, Liji Anish. So now we are about to begin the reading module discussion. So we are going to discuss part A today. So as you can see on the screen, the OET reading subtest is subdivided into three parts. Okay, this is especially useful for those of you who are attempting for the very first time. So these instructions are going to be crucial for you. So the reading subtest is subdivided into three parts: part A, B, and C. And regarding the number of questions from each module, you will have a total of 20 questions from part A, 6 questions from part B, and 16 questions from part A, totaling up to 42 questions. Okay, and regarding the time duration, you will have a total of 60 minutes, that's an hour, and for which part A will be allotted 15 minutes and part B and C together 45. So those were the general instructions. So now regarding the part A section of OET reading subtest, what I need to tell you is that part A will usually consist of 4 short texts, and it will be related to a single healthcare topic, and this will be followed by 20 questions, and and the type of questions that you can expect from part A are matching type questions, sentence completion, and short answer type questions. Okay. These are the kind of questions, a pattern of questions you can part A. And so what does part A basically do? That is, it assesses your ability to locate specific information from the short text in a quick and efficient way. And reminding you that you have just 15 minutes of time allotted for part A, and you need to complete 20 questions within that short span of time. Okay. So that's a challenge. So now we are going to begin the discussion of a part A module. So as you can see on the screen, so this is a module of OET reading subtest, and as you can see on the screen, you will have 4 short text. So this is text A, and it is having around 3 paragraphs, and the B will have another paragraph, and C it's consisting of some steps and points and tables, etc., and stages. Okay, so and text D is a set of another set of points, and that needs to be followed. So these are the 4 short text I'm talking about. Okay, and this will be followed by a set of questions. You will have 20 questions in total, of which and these three there will be 3 categories of questions following the 4 short text. Okay, 3 categories are, the first category is, I'll just read the instruction of those questions. You will kind of understand the pattern of question. So for each of the questions 1 to 7, decide which text A, B, C, or D the information comes from. You may use any letter more than once. Okay, so what you need to do is that for questions 1 to 7, you just need to identify where this sentence or information mentioned in questions 1 to 7 is from, whether it's from text A, B, C, or D. Okay, so you just need to identify the section and just write the section names, that is whether it's A, B, C, or D. Okay, so that is what you need to do, and that can be done very quickly in a very short span of time. And then after that you have another pattern of questions, that is questions 8 to 14, and I'll just read the instruction of that set of questions. Answer each of the questions 8 to 14 with a word or short phrase from one of the texts. So each answer may include words, numbers, or okay. So what you need to do for questions 8 to 14 is that you need to pick up a specific answer, so that may consist of 1 word or 2 words, or phrases, very rarely. So phrases in the sense more than 2 words, that is like 3, 4, 5 words. Okay, those are rare cases, but usually you can expect 1 or 2 words as answers. So you need to quickly and specifically find those answers for these questions, for questions 8 to 15. And for questions 15 to 20, this is a similar pattern. That is, I'll just read the instruction, that is, complete each of the sentence 15 to 20 with a word or short phrase from one of the text. Each answer may include words, numbers, or both. Again, you can fill in with words, numbers, or both. Okay, and this may also include uh, a word or 2 or short phrases in rare cases. Okay, so you need to specifically locate the answers in this case. Okay, so first, how do you go about finishing or cracking part A? Is that first you need to read the set of, okay, that is called skim reading. You need to read it very quickly. Okay, so when you read it very quickly for the very first time, your aim or your intention is that you need to identify where each information is. It is like the introduction, the overview, the definitions. Where is that located? That is usually located in part A. So you just need to identify whether it's in part A or whether there are some definitions in other parts also. So these are some things that you need to note or keep in mind. And then this will be followed by usually clinical management overview, um, assessment, test, diagnostic test, okay, clinical assessment, and diagnosis. So all these signs, symptoms, this kind of information will be usually in part B. So when you skim read it, your intention is that your aim is that to locate those information. You just need to identify where each information is, signs and symptoms A or B. Okay, usually these are in these areas, but then just to make sure. So just identify these information, just underline, just you can underline a circle or you can write also. If there are no headings and if you cannot find words, or you can just write also information that is required to identify where each information is. And then after that what you can do is go to the next text. Okay, usually part C will have treatment methods, the medications, the dosages, etc. So you can just check whether you have those information in part C, or where there are new kinds of information. There are other management procedures, steps, stages, etc. You can just check, okay, what all information can you find in each. You can just check all these when you read for the very first time. And the last part usually will consist of prevention techniques, vaccination, follow-up procedures, management, so self-care, self-help strategy. So this is usually the order in which you will have text in, but then it may vary slightly, because sometimes the little of these information will be in part A, some of which I told, and that you can locate in part B will be slightly it will be in part C, and from yeah, so there will be slight variations. So your very first intention when you read it is to locate this information. Once you have located it, just underline it, highlight it, okay, so that you can understand, okay, where it is. And after that you can straight away come forward and you can try reading the questions and then locating the answer quickly from the full text. So, and when you read the question, just make sure you understand where the answer for that question will be, because you can't just go and hunt for the answer in all the four paragraphs, or in all the four texts. Okay, for the information, you don't have that much of time for reading all the four texts, or for all the 20 questions. You don't have that much. So what you need to do is, whenever you read a question, you will get an idea where that information will be in. Okay, so for example, if I tell you that um, yeah, so look at this question number 9. How, what might patients with dengue fever complain of? So that means you will get an idea, okay, that must be some of the signs or symptoms or something like that. So when you read the entire set of text for the very first time, you must have got an idea, okay, signs and symptoms are in this part. Okay, so where do you want to look for this information? Okay, whether it's A, B, C, or D, when for whichever part you have located this information, and when you read for the very first time. So just go to that part and hunt for the answer. You can't just have no idea and just look at all the four texts and hunt for the answers. You don't have each that much amount of time. Okay, so whenever you read it, underline the important parts of the question and identify where this information could be from, and just read that part of the extract, whether it's A, B, C, or D. Okay, and the next question is, I'm just giving you an example. If it is about test, okay, the test or assessment, diagnostic test, okay. So these, when you just read for the very first time, if you have identified whether this information, like it was in like B part, for example, then just go to B part and search for the information. Don't just look at all the four parts and try to find the answer. You're just wasting. You will be doing that. Okay, just keep those points in mind. Okay, whenever you read the question, just underline. Okay, the important points, relevant details, and then just look in, think for a second and identify where this information is from, and just read that part and locate the information. Okay, so that is something that you do. So now we'll just go about solving this section. Okay, so what I usually advise is that since a part the first set of questions, that is 1 to 7, those are easy. So that is, you just need to locate where this information is from, and just need to write whether it's from section A, B, C, or D, and that is going to be very very easy, and you might need just 1 or 2 minutes to solve all those 7 questions. So what I would recommend is that you can keep it for the last. Okay, because if you start from that section when you are just beginning, you might not get an exact idea where each information is from, so you'll just take time to solve those 7 questions. So, but if you start from 8, by the time you are done solving all the 20 questions, like from 8 to 20 questions, then you will get an idea where each information is from. That will be thorough to you. Then you need not even turn back and check where this information is from for questions 1 to 7. Okay, so I'll just recommend you keep it for the last 2 minutes. You can just do it very quickly. Okay, but for questions 8 to 20, you will need in-depth reading. So I'll recommend you start with that. So yeah, so now we'll also start with this section. Okay, so before that we'll just skim read it. So we'll just read it very quickly and identify the important information and highlight or underline whatever we feel is important. Okay, when you just read it for the very first. Okay, so dengue fever is a viral disease spread only by certain mosquitoes, mostly this is diphtheria or dengue mosquitoes, which are common in tropical areas around the world. There are 4 types of dengue virus that cause dengue fever. That's dengue type 1, 2, and 1, 2, 3, and 4. So we'll just highlight whatever we think is important. Okay, so that's going to be easier for us. So yeah, this is the definition of dengue fever. So I'll just highlight this part, okay, so that you know that there is a definition over there. And where is it common? So I'll just highlight the common words, so it will be easier for us in case if there is a question like that, you will know where it is common. And then there are 4 types. Okay, so regarding the types also, I'll just add that information. So this is how you actually highlight or underline information. You don't just underline or highlight the entire set of text, so that then again it will all look same to you. You will not understand much, because you are going to underline each and every line. If you, whatever you feel is important, just highlight the keywords so that you will understand where each information is. So yes, again, four types. Then what they have mentioned is people become immune to a particular type of dengue virus once they have had it, but can still get sick from other types of dengue if exposed. Yes, so catching different types of dengue and even year apart increase the risk of developing severe dengue. So severe dengue case causes bleeding and shock and can be life threatening. So, so we'll just highlight this information that what the severe case cause, and it's going to be life threatening. Okay, so yeah, and then moving on. So dengue mosquitoes only live and breed around humans and buildings and not in bush or rural areas. Okay, so where do they live and breed? Okay, let's highlight that set of words. Okay, so you will get an idea, and then they bite during the day, mainly mornings and evenings. Okay, dengue mosquitoes are not born with dengue virus in them, but if one bites a sick person having the virus in their blood, that mosquito can pass it on to another human after about a week. Okay, so yeah, so and then this time gap for virus to multiply in the mosquito means that only elderly female mosquitoes transmit dengue fever. So only elderly female mosquitoes transmit it. Okay, and then the mosquitoes remain infectious for life and can infect several people, and dengue does not spread directly from person to person. Okay, listen, highlight this information also. Okay, so moving on. So that's about text A. Okay, so text A, what was the information we gathered from text A? That we have this definition. Okay, and we got this information that there are four types, and then what the severe case cause and how is it life threatening, and then we also got information about where they live and like in what situations and how they breed, and also about yeah which type of elderly, yeah which type of mosquitoes transmit it, that is the elderly female mosquitoes they transmit it, and yeah, and how it spreads from a mosquito to a human, and also the information that we gathered is that it doesn't spread from a human to another human, it just spreads from mosquito. Okay, so these are the information we gathered from part A. Okay. So when you read it for yourself, when you are actually trying to solve a paper, you need to yeah you need to actually do it really more quickly. Okay, because um, a little more faster reading is required because okay, so and because that is very essential because you don't have the amount of time. Okay, so today because we are reading like this, so it's a live session, I'm just explaining it. Okay, whatever we have gathered, so that should be your approach. Okay, so and then moving on to text B, then that you can see the heading is signs and symptoms. Okay, that they are just helping you with this, so you just have an idea what the information will be um, in text B. So just look at this classic dengue fever or break bone fever. Okay, so you have another name also for dengue fever, and this is characterized by acute onset of high fever 3 to 14 days after the bite of an infected mosquito. So the onset is after 3 to 14 days after the bite of an infected mosquito. And symptoms, so what are the symptoms? Symptoms is in this area, you don't have to underline or highlight all the symptoms because now that will create a lot of confusion because that would mean essentially underline everything over there. So I'll just highlight this word symptoms so that we'll know that where this that information is. And then the patient also may complain of weight loss and nausea. Okay, acute symptoms when present usually last about 1 week, but weakness, malaise, and weight loss may persist for several weeks. Okay, so acute symptoms are usually about 1 week, and then yeah, and some other symptoms where may last for several weeks, and then high proportion of dengue infection produce no symptoms or minimal symptoms. Okay, so yeah, and especially in children and those no previous history having a dengue infection. Okay, so high proportion of infections produce no symptom. Yes. Moving on, text C. So another heading there. Steps to take when seeing a suspected case of dengue fever. Okay. So these are the steps that you need to take, or the precautions that you need to take. Okay. So step one is notify your nearest public health unit. Okay. Then and then step two is take comprehensive travel history and determine whether the key was acquired overseas or locally. Okay, so you have to take a comprehensive travel history, and then step three is know the date of onset of symptoms to identify the correct diagnostic. Okay. The date of onset of symptoms, that should be noted, as a suitable laboratory tests depend on whether the blood samples collected during when the blood sample is collected during the illness. So identify the correct diagnostic. So yeah, those are the important points. Moving on, another useful test is full blood count test. Cases often have leukopenia and or thrombocytopenia. So yeah, and then there is a table over there. The table below shows which test to order at which stage of illness. Okay, so you have a set of information over there in a table. So you have this test type and then days after onset of symptoms. So there are different test types and how many days after onset of symptoms. So those are also mentioned. Okay, yeah. So moving on to stage 4, these are the kind of information mentioned in step or stage 3. Okay, provide personal protection advice, that is mentioned over here. Highlight that information also, and then you have a set of points, just go through them. Also, the patient should stay in screened accommodation and have someone stay home to look after them. Okay. So screened accommodation, and you have to have someone stay home to look after, and then the patient should use personal insect repellent, particularly during daylight hours, to avoid mosquito bites. And the next point is all household members should use personal insect repellent during daylight hours. Okay, and not just the patient. Okay, and hope this is visible to you. Yeah, and the last point, advise family members or associates of the case who develop a fever to present immediately for diagnosis. Okay. Okay, so that is the kind of information in part C. So now moving to part D. Okay, you have this heading prior to discharge. Okay, so what are the steps you need to do prior to discharge? Okay, so tell patient what are the advices you can give. Okay, so tell the patients to drink plenty of fluids and get plenty of rest. So I'll just highlight that information. Tell patients to take antipyretics, control their temperature. Children with dengue are at risk for febrile seizures during the febrile phase of illness. Um, yeah, and then moving to the next point, warn patients to avoid aspirin and anti-inflammatory medications because they increase the risk of hemorrhage. Moving on, monitor your patient's hydration status. Just highlight that. During the febrile phase of the illness, educate patients and parents about the signs of dehydration and have them monitor the urine output. Educate monitor. Okay, so now the next point, assess hemodynamic status frequently, checking the patient's heart rate, capillary refill, pulse pressure, blood pressure, and urine output. If patients cannot tolerate fluids orally, they may need IV fluids. And then the next point is perform hemodynamic assessments, baseline hematocrit testing, and platelet counts. Again, assessments. Okay, and then last point, continue to monitor your patients closely during reference, and the critical phase of begins with the effervescence and lasts 24 to 48. Continue to monitor. Okay, so these are the important information from all the four texts. We have highlighted all the important information that we felt was required or essential from all the text. Moving on to the set of questions. So we'll start with question 8 first. Okay, how long after being bitten by an infected mosquito does high fever occur? So what do you think the answer would be? Okay, you can put in your choice of answers in the comment section in Facebook. Okay, so you can put in your answers and also the text numbers, whether it's A, B, C, or D. So from questions 8 to 20, you need to write the specific answer, that is the word or phrase. Okay, so they are asking about how long after being bitten by an infected mosquito does high fever occur. Okay, so high fever, so that is what do you say, a sign or a symptom. Okay, that is followed after an infected mosquito bite. Okay, so where do we find those information? It's about the signs or symptoms, right? So we'll just locate this information in the signs and symptoms and part B or text B. Okay, so check if you can find that information. I'll just read the question again. So I just want you to give me the answer. You can comment your answers. The question is, I'll read the question again. How long? They are asking for the time duration. After being bitten by an infected mosquito, does high fever occur? How long? So they are asking about the time duration. You can just see if you can locate a time duration after it is actually connected with high fever. Yes, I can see answers coming up. So BGIJO has responded with 3 to 14 days. Okay, Lejuke Nair also responded with 3 to 14 days, and Lindsay John also responded with same answer, 3 to 14 days. So good. So and indeed the answer is 3 to 14 days. So yeah, we have already highlighted that information when we first read this text. Okay, because we felt that was important, right? Because yeah, those are the important points. We'll just write here. So how long? So they are asking for time duration. So units is whether it's days, months, years. Okay, so or hours means okay, whatever it is, it's not mentioned. So we have to mention it. Okay. So in cases where it's mentioned in the question, like how many days, if they are asking, you just need to write 3 to 14. You need not write days again. In this case, we need to, because it's not mentioned whether it's days, years, months. Okay, Okay, moving on to question number 9. What might patients with dengue fever complain of? Okay, so they are asking what again? They are asking about the signs and symptoms. Okay, because usually if a person has to complain with, that should be the signs and symptoms of the illness. Okay, so I'm just highlighting this part of the question because that gives you an idea where this information is from. High fever, again, that was another sign and a part of sign and symptom. Okay. Okay, so again, moving to part B where we have signs. Yes, so yeah, over here. The question is, I'll read the question for you. What might patients with dengue fever complain of? Check if you can find this information here. Something regarding to complaint. And just give me the answers. You can comment your answers in the comment section Facebook. Okay. Yeah, previous answer were given by Bisi Nobi, Smita Raj. Try to locate this information. What might the patients complain of? That sentence should be in signs and symptoms because it's usually complaint is about the signs and symptoms. Yeah, I can see answers coming up. And Juicy Putin has responded with weight loss. Yeah, Smita Raj responded with weight loss and nausea. Um, Lindsay John also responded with weight loss and nausea, and that same answers given by Bijayaju, Lata Jibaraj, Alana Naveen, etc. Any other answers? Yeah, Anju Akil has also responded with weight loss and nausea. Okay, so yes, that is the correct answer. So congrats to all those who have responded with the correct answer. Yes, it's weight loss and nausea. I'll just write in green. Okay, moving to the 10th question. Which test should only be ordered 5 days after symptoms appear? Just think which part holds this information. Just think. Meanwhile, I'll just type that answer in. Where do you think this information is from? See, because now they are asking about the test. So we did come across this information when we first read it. Okay, hope you remember about the test. Okay, so as I told you, this information about the test, etc. We came across this information in part C, right? Where there was this test and the stable, etc. They were talking about, yes, for the test. Okay, so over here, okay, so it is over here that they were talking about the test. Okay, so the useful tests, full blood count test, etc. So they were talking about this information, and now the question is, I'll read the question again for you. That is, which test should only be ordered 5 days after symptoms appear? After 5 days. So yeah, what do you think is the correct answer by looking at this information? only after, will be ordered 5 days after, that is after 5 days. This is PCR, this is NS1 ELISA, this is IgM, and this is IgG. Okay, so I can see answers coming up. Biji Aju has responded with IgM, Anju Akhil with IgM, Smita Raj with PCR, Leni Chako with IgM, Bisi Nobe with IgM. See, the question is, just pay attention to the question, is how many days after, or it's after 5 days that they are asking. Test should only be ordered 5 days after. So if you write PCR, is it after 5 days? Just think, um, okay, whether it's IgM or PCR, it's between these two options, I guess. Okay. Okay, Sharath S. Shiva has responded with IgM, Leju Kinar with IgM, Anju Sionakutan with IgM, Lata Jibaraj with okay, NS1 Elisa. Okay. Okay, so I think it's time for me to give the correct answer. The correct answer is IgM. Okay, because they have written it's from day 5 onwards, that is after 5 days. Okay, so you cannot take PCR because it's from 0 to 5 days. So clearly below 5 days. Okay, so and the question is it's after 5 days. Okay, so you can only take IgM for an answer. Most suitable answer, and just type in the answer. Meanwhile, you can read the next question. What are the test is also useful when checking for dengue fever. Again, they are asking about the test. So just think where this information could be from, and then we'll locate it. Just type in this information over here. Okay. So again, they are asking about the test. So I'll just highlight that part, and that is going to give you a clear idea which part of this extract should you look or search for this information. Okay, you can't just go and hunt for this information all the food. Course, we don't have that much of amount of time. So whenever you read the question, it is very important that you identify that point itself where this information would be in. So again, they are asking about the test. So yes. Again, moving to the same portion, it's text C again, where we have information about the test. Okay. So yes. Yeah. The question, I'll read the question again for you. What other test is also useful when checking for dengue fever? Also useful, or they're asking about, yeah, also useful is the word. Okay, so another useful test. Can you see this information? I hope you have seen this information. So that's very easy, because the question is what other test is also useful when checking for dengue fever? Okay, you can put in your choice of answers in the comment section Facebook. So this is also probably easy, because you can see this information over here, right? Another useful test is, okay. So that is the test they are asking about. Another useful test. Okay, so we'll put in that information over there. Okay, so now moving to the next question, question number 12. Who is at risk of seizures during the febrile stage of day? Okay, the risk of seizures during the febrile stage of dengue. So where do you think this information would be in? Okay, so if you remember, we did highlight or underline this information when we read this. Okay, I'll just highlight the part of the question also which we think is important. Seizures during the febrile stage. Okay, we'll just move and try to locate this information. This is, yes, we have already highlighted this information when we read text. Can you locate this information and give me the answer? The question is, who is at risk of seizures during the febrile stage of the illness? Try to locate this information, put in your answers in the comment section Facebook. Yeah, I can see most of you giving in previous answer. Eleni Chako, Lejike Nair, Lata, Jeba, Anju, Akil, Smita Raj. Congrats to all of you. Yes, I can see answers coming in already. So Anju say Omnikutan has responded with children, Alana Naveen with children, Smita Raj with children, Lata Jibaraj and Lejuke Nair with children again. Yes, Reena Matthews with children, uh, Visi Nobi with children, Anju Akil with children, and Sharath S. Shiva also has responded. uh, Children. Okay, and that is the correct answer. So congrats to all of you because you can see this information here, right? I'll just highlight that information. Children with dengue are at a risk of febrile seizures during the febrile stage of the. This is the sentence. Okay, that is why your answer should be children. Okay. So, meanwhile, you can read the 13th question. What takes place in the most lethal cases of dengue? Most lethal in the sense, most dangerous, most deadly, okay, or most, what do you say, severe, okay, or life threatening. Okay, those are the synonyms of lethal. Okay, so whatever comes to your mind when we say this, so you can just think where this information was from, which part did you see this information in. Meanwhile, I just type in this information. Yeah. Most lethal case, or most life threatening, severe case. Okay, so if you could remember where this information is from, it was from the very first part where we discussed about the severe cases also and life threatening. That see, when you just move and if you just so just look at this information, you can see that we have already highlighted all the relevant things, and this is among those relevant information. Look at this information. What life threatening? Lethal means life threatening, deadly, dangerous. Okay. So the question was what takes place in the lethal cases. So what takes place? Look at the sentence. Severe dengue causes bleeding and shock. Can be. So what should the answer be? You can put in your choice of answers in the comment section in Facebook. Which, what should you write as answer? Anju Akil has responded with bleeding and shock. Okay, so and Smita Raj has also responded with bleeding and shock. Sharath S. Shiva, Leni Chakko, Leju Nair have also responded with the same answer. Also, BC Nobi also responded with that answer. And yes, let me give you the correct answer. It is indeed bleeding and shock, as you can see over here. Okay, so now fill in this information over here, and now moving on to the next question. While I fill in this information, you can read that question. Moving on to the 14th question. How long does the most serious stage of dengue last? Again, about the most serious case. Okay. And they are asking how long. That is the time duration also. Long and most serious stage. Okay. Okay, so where do you think this information will come from? You can just look for that information. Yeah, the D part. It's over here. Okay, can you find this information over here? Because they are telling about the most serious stage. Okay, serious stage. Serious has other synonyms. Okay, so just think of words that would almost mean the same as serious stage. Okay, and then you will be able to locate this information. They are asking for the time duration. In the most serious stage, how long will it last? Can you find this information over here? Yes, Smita Raj has responded with 24 to 48. Just 48? You can measure the duration, or you can just mention the duration also, because it's not specifically mentioned in the question how long. So it's whether it's hours, minutes, days, months, years, it's nothing is mentioned. So you need to mention the units. Okay, whenever that's very important for all of you. So Visinobe is responded with 24 to 48 hours. Sharath S. Shiva has responded with the same. Anju Akil with the same, and Lejukin same. Yes. Okay. Yes. So that is the correct answer. So congrats to all of you who have responded with the correct answer. The last line. So instead of serious, they have mentioned it's critical. Critical is a synonym of serious, right? So in the critical phase of dengue begins with this and the last 24 to 48 hours. So the answer would be 24 to 48 hours. Okay, so now moving on to the next part. Okay, so question number 15, dengue fever does not spread. Okay, it's about the spreading. Okay, do you remember where did we find this information about the spreading? It was in part A. Whether it spreads from human to human, or whether it spreads, how it spreads from mosquito to human, etc. Okay, so all this information was from part A, if you remember. So they are asking, so I'll just bring text A upon the screen, and then you can locate for this information. And the question is, it does not spread dash. Okay, so about dengue fever. So yeah, so what do you think is the correct answer? Dengue fever does not spread dash. Can you find this information? Yes, I can see most of you giving your answers. Lindsay John, Lejukenar, Bisino Bish, Sharath S. Shiva have all responded person to person. Anju Akil with directly from person to person. So this, yeah. So yeah, I can see. Yeah, that is all. Yes, it is the correct answer. This the last line that you can see on the screen. That is the correct answer. I'll just highlight that information also. You can write directly from person to person, or you can just write person to person. That would be correct. Directly. Rare cases wherein you will have phrases as answer. Okay, so next question 16th. In many dash, dengue infection cause almost no symptoms. Okay, so in many what? Okay, about no symptoms, we did come across that information. Do you remember about it causing no symptoms at all in specific cases? So we came across that information in part B. Yeah. So about the question was about symptoms, right? So signs and symptoms, those are essentially in part B. Just look for this information part B only. You need not search the entire set of text, okay, for this answer, because that's going to waste time. Okay, just try to find this information. So in many dash, dengue infection cause almost no symptoms. Can you find this information over here? Then give me the answer. Okay, so I think some of you are confused with high proportion or whether children is the correct answer. See, in the questions, they have already mentioned many. Okay, so that means a high proportion. So you need not mention that again as an answer, right? So what else can you mention? Where can you see this info? Who can have this infection? Okay, so that should be your aim. So just eliminate repetitive terms, okay, because many will indicate a high proportion only. So you can eliminate that part of the sentence and then look at the other part wherein you will get more specific answers. So the correct answer for this question would be children. It's correct. I think some of you have answered children. Sharat has answered children. Lindsay, children. Yeah. Others have made a mistake, okay, because it's a repetitive term, because many is mentioned, that's a high proportion and need not repeat that again. So moving on to the 17th question. Within 3 days of symptoms beginning, a PCR or dash can be ordered. Okay, so PCR is another test that was included in part I think C, right, where there was this table, etc. So the question is, within 3 days of symptoms beginning, a PCR or dash can be ordered. So after 3 days, definitely PCR can be ordered because that is within 0 to 5 days. So what else can you order within this 3 days? So that's an easy answer because there is just one other option. Um, you need not get confused, right? Because there is one other option that you can include. Within 3 days of symptoms, beginning a PCR or a dash. Within is important. Yes, I can see answers coming up. Anshu Akil has responded with NS1 Elisa, Lindsay John with NS1 Elisa, Sharath S. Shiva with NS1 Elisa, Lenny Shako with the same. Yes. So the correct answer is NS1 Elisa. So I'll just highlight that information because they have written that it's within 0 to 9 days, right? 0 to 9. That is why. Moving on to the next question. Within 3 days, to avoid hemorrhage, patient must take anti-inflammatory medications or dash. So where do you think that information is? Anti-inflammatory medications. Okay, so the mentioning of anti-inflammatory medication, where was that? It was in last part, right? Yes, it is over here in the D part. So where do you think the information is and what do you think is the answer? The question is to avoid hemorrhage, patients must not take anti-inflammatory medications or dash. What else should they not take or avoid? And now that's an easy answer because we have already highlighted that information. We have highlighted all essential or important information. So, okay, so I'm just going to give you the answer because we are running out of time. So, yes, the correct answer is aspirin. Okay, so this answer is over here. Okay, it's an easy answer, direct answer. Avoid aspirin and anti-inflammatory medication is what is mentioned. So, aspirin is the correct answer. Moving on to the next question. Advise patients be cared for by someone at home in dash accommodation. That is the next question. Okay, so about patients being taken care of by someone at home. Okay, so that information was in which part? Do you remember that? So yes, can you see this information over here? It's in the last part of part C. So can you see that? We can see this information. Yes. The patient should stay in screened accommodation and have someone stay to look after them. So the question was advise patients be cared for by someone at home in dash accommodation. That means what kind of accommodation? The answer should be screened. That is also direct answer. So now moving on to the next question. That's question, last question, 20. We have questions 1 to 7 remaining. Okay, just reminding you. Okay, question 20. Patient must be made aware of the need to check their dash. What should they check? Okay, so where did you find this information? Do you remember this coming across this information? It was in the last part, I guess. They should be made aware the need to check their dash. Can you see this information over there in this part? Okay, so the correct answer for this question would be this sentence. Okay, educate patient parents about the signs of dehydration and have them monitor their urine out. This is the correct answer. So instead of check, they have mentioned monitor. That is the only difference. And instead of made aware, they have mentioned educate. These are synonyms that they have replaced with easy synonyms. Okay, moving on to questions 1 to 7, which is the easy part. You just need to identify where this information is from. You need not even go back and check because that's going to be easy. Different types of dengue virus. Okay, that's a very easy section because we came across this information where in part A. Okay, because we are running out of time, I won't be able to give you enough time for you to answer also. So yeah, I'm just yeah, going quickly. So moving to the second question: how fever presents in patients? How does it present in patient? So present in the sense signs and symptoms, etc. Right? So that is just you remember the heading, right? So now moving to the question 3, how dengue fever is transmitted, about the transmission. Transmitted from humans, from mosquitoes to humans, and does not transfer from human to human. All those information was in text A. Remember. Fourth question, the stages at which to conduct test for dengue fever. About the test, they have mentioned about the test in part C, and then monitoring and assessing a patient's condition. Yeah, that was in part D. Then question 6, what advice to give patients to avoid mosquito bites? To use, I think, mosquito repellents, so insect repellents, etc. That was, yeah, information part C. And then the last question, advice for patients regarding medication. That is again in part D. Okay, what type of medication to use or not use. Okay. So with that, we have completed the discussion of a section of the reading subtest. So I hope you have understood whatever we have discussed today, and hope this session was useful to you. So see you next week. We are winding up the session for today. So thank you for joining. Take care.